are not done nearly as frequently as they were in the past, and patients to be hospitalized. The quality of life has really been greatly served by this advance.
One of those painful exams that CT now frequently replaces is pneumoencephalography. Esther Sadalski of Milwaukee describes one.
After all the tests, then the last test was the pneumo. They took me down on. They sat me in front of looked like a large. Do not move. Well, after I took my hands off of that bar, I opened my fist and my nails were embedded in my palm. That's how painful it was.
These pneumo exams have now been replaced by CT exams, which give better information with little patient discomfort.
And care of the patients that present at the modern emergency center. This is true for a wide variety of disease states that present at the emergency center, but is particularly true for the head trauma victim. Here we have an example of a young man in an auto accident who sustained severe head injury, and when seen in the trauma section, the CT scanner, we were able to quickly make a diagnosis of right frontal lobe. Following this, the patient will be going promptly to the operating room.
Can CT give you more complete information than other tests?
It's shaved 5 inches down, and the surgery was successful, and I'm now back in school pursuing my pre-med major.
Patients who have experienced CT and the alternatives are quite sure how they feel about easy, painless CT exams. No dispute here. Primary physician decide what diagnostic exams to request. At Emory University School of Medicine, Atlanta, Dr. Peter Soames, Director of Body CT, Angiography and Ultrasound, at the left, and Dr. Robert Smith, Professor of Surgery.
We readmitted him to the hospital, concerned that he might have the site of one of his connections with the aortic graft. The CT scan was one of the first studies that we obtained.
Well, you can see from the CT that the aorta in the upper abdomen is essentially normal, but at approximately the site of the proximal anastomosis, you can see the contrast-filled lumen of the graft here, mass engulfing the aorta, which is typical of the appearance of hematoma or false aneurysm at that area. You can see that it extends farther down into the abdomen.
You know, this doesn't fit well with the aortogram because I believe that was interpreted as normal.
Soames, what's the scope of CT's contribution to treatment of cancer?
CT provides very important information about the treatment of cancer. Lymphoma, which is a cancer of the lymphatic system, case in point. With the use of CT, we can determine the presence or absence of tumor, as well as its extent of spread throughout the body. Knowledge about the extent of spread, that is, the organs involved, is critically important in determining whether radiation therapy, surgery, chemotherapy, or some combination is most effective in any given case.
Scoliosis, which is curvature of the spine. In scoliosis, the surgeons can straighten this both from a cosmetic and a medical point of view. For the first time now with CT, we can very simply and very quickly and very safely identify if there is any underlying cause of the scoliosis, because if there is, this is where CT is important, because it can detect this underlying cause and indicate the precise level and the precise abnormality the surgeon should remove before he straightens the spine, because the patient may run into complications because of the straightening. Or he may detect an abnormality that may tell him that he should not straighten that spine at all. And we are now using CT more and more in the diagnosis and identification of these curved, twisted spines.
This is Cheryl Stevenson. She has a very personal experience to relate about the CT examination.
I'm currently a sophomore at Oberlin in Ohio, and for the past 7 years I've been affected by small seizures in my left hand until last year, and I had a large seizure which I became unconscious with. This followed with which they diagnosed a tumor in my brain. I had several other tests after this, and it was an EEG and an angiogram, which didn't assist the doctors at all, so I was proceeded with another second scan. Doctors were able to pinpoint it down so